You learn this, whatever points we are teaching, you learn this and practice it on someone. That is more important, because this reflexology, magnetotherapy, like you can just learn by listening and then you can apply it. But reflexology is something practical approach. You cannot learn the whole of the acupressure and reflexology just by sitting online in front of computer. Whatever I will teach you, whatever points we are discussing, finally you have to apply those points on somebody. Like in today's session, we will discuss those 15 points. So what I will do is I will explain you, okay, see, this is the picture, Melissa, here are the points. Now, if you apply those points on your husband's like different body parts, okay, these are the points for the head, or this is the for the back, or this is for the palm, then only you will realize. Because there is a thing comes which is like face reading. What a reflexologist do is a face reading. Good face reader you have to be, because the whole body acts like a computer, and your hands and your feet, they are like input. So whatever point you are giving is you are putting a input, but where the outcome will come, on the screen of the computer, which is your face. So if you are pressing a point and the face is like giving certain expression, okay, yes, there is a certain pain in the point, then easily you will know, yes, I have got the right point. But you are giving very good pressure, even after the good pressure the patient is feeling nothing, then you can know, okay, I have to keep searching somewhere nearby. These days there are several instruments available, like there are several very advanced machines in the market which can just locate point for yourself. You just rotate the machine on the palm, and it will show in the meter, okay, this is the point for this, and this is the intensity of the point. It will also digitally, it will show if a point is reading, it will give you the higher reading, 200, 300 points. So you will show, okay, now you can treat with the same device also. So but to like, it is okay to use the machines, but at least you should know how to manually do it, because this is the science of layman. You know, many times I have treated many people while I am traveling in the train, or I am traveling in the bus, even sitting in the car, because you don't need anything basically. It is in the first class we discussed, it is drugless, but along with drugless, it is also like cost effective, costless. You don't need certain gadgets. If you have, that is okay. If you are like getting big number of patients every day and you have to treat almost 15, 20 people in a day, then it is okay to use certain machines. But you are like exclusively treating only 3, 4, 5 clients a day, then you can better use the hands only. And my observation is like in, especially in European countries and all, like USA, UK, those people, they don't like machines much. They already enjoyed the machines. They have everything, all the machines they know. But they feel more comfortable. They like much if a therapist like treat with the hands manually. Either you can use gloves or with the bare hands as per the comfort of the patient. But with the manual treatment, they are more satisfied. They pay more for the manual treatments, because machines anybody can learn in today's machines and they can use it. So better first to learn it completely manually, then you can have machines. We do have machines in our centers, treatment centers. So better first learn manually. That is the key. So what we were discussing about is the theory of the acupressure. I hope that is all clear. I also shared you the video, how it works. It activates the blood circulation, then the flow increased, all the toxins in the flow, they being thrown out from the body in different forms, like perspiration, like the stool, and like urine. So different ways the body cleans and process the toxins from the body. But even after that, some crystals, some toxins, they get deposited in the nerve endings, and those crystals, they create an obstacle in a bioelectricity flow. So that is the point where we have to work. Wherever the bioelectricity flow will be leaking or it is not flowing well, there will be pain. So if you press like one thumb with some finger or some object like this, and if the patient is feeling some kind of pain, if they are saying, yes, I have a pain, this pain is different from the pain which we generally push. Like if we push some more with more pressure, and a natural pain will come. But this is not that kind of pain. It is quite like chilling pain, you know, some cold kind of pain. So that is a different kind of pain. You will feel if you find a Jimmy or with a pen, with the back of the pen, you try to push certain points in your body. Like in especially your case, if you will press on this line, in this line of your hand. So this is in the chart. I have given you a chart. In the chart, you see this is a thyroid and parathyroid glands. Okay. So I assume by saying your face, I assume you will be having certain pain on your thyroid and parathyroid glands because the thyroxines, the different 13 hormones in your particular body, they will be in disbalance. This I have
no.
Yeah.
I have no thyroid.
Yeah.
My thyroid out.
Oh, you have removed it?
Yeah.
See, now you see, I have not touched your body. I have never asked you about any diagnosis. But exactly what point I gave you is the thyroid problem. And I just observed the face and I have given you the idea. So this is what comes with the experience. So if you press these points or if you see this in the chart, this is exactly thyroid and parathyroid glands. Now, if you press these points like this, if you hold it like your thumb and this, and you will press it like this. Try to press it like this. No, thumb there,
this way.
Thumb this side.
Yeah.
Now, put your thumb here at this point and then press it. Press it little more, little tough, and see on your face, you will have certain kind of this chilling pain. So this is because of that problem. It doesn't matter if you have removed your thyroid glands or not. But even after that, this pain will be there because the problem was there in the body. So there was some energy leakage here. So how you can cure this is regularly you will press it like this 3 to 5 times each time for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is one round complete. Then you can rest for 10 seconds. Then again you can press it for 10 seconds. This is one technique of pressure. This is called tapping. What I'm doing is I'm tapping the point like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is what I did for tapping therapy I did. And on thyroid, parathyroid glands points I did. Then I have another option to rotate the point. Rotation is like making a circle, not lifting the finger from the point. I am not lifting the finger from the point. I have just fixed it at one place. Then I am pushing it in. Then I am rotating it like this. You see, slowly. So now try it. Again, you will have acute pain on that point, like this. Because this thyroid, parathyroid glands, if in your school days, you remember, you were taught by the teachers that this is responsible for your body weight, for the shape of the body, and for the daily activity with your energy, stamina. It is all connected because it controls nearly 13 different hormones in your body. Thyroxines. You remember? So that can be activated by rotating it clockwise. This is very important. If I am rotating a point clockwise, I am basically accelerating the generation of endocrine to accelerate the powers, to accelerate the hormones, to increase the levels of the hormones. You have to stimulate the points clockwise. Got it? Okay. If any particular point you want to reduce its energy, like for the weight loss. So in case of weight loss, the same point you have to rotate reverse clockwise, anti-clockwise. A person who want to reduce the weight, you can give them the same thyroid, parathyroid point in anti-clockwise like this. What if? It is not by pressing this point you will lose the weight or you will gain the weight. Body is very smart. Your mind is very smart. The body will naturally adapt the situation, whatever is necessary. If I am underweight, I will not lose more weight by giving it a reverse direction movement. Basically, my metabolism will be okay. My metabolism will be balanced. It will be harmonized with the nature or with my own system. So that will happen. This reflexology will not do anything like in terms of what I'm saying is in terms like it will not kill anything in the body or it will not generate anything in the body. It will basically try to harmonize your body or your system, your internal systems with the nature. So that's why it is called the science connected with the nature. I explained you in the first session, whenever if you are walking bare feet on the ground, have you started walking bare feet on the ground after the
A little
session?
bit. Yeah.
Yes.
Where I live, it's
Every
not very
day, try to avoid sleepers for almost half an hour. One or two advice I give you. For half an hour, try to avoid the sleepers. Try to roam bare feet, maybe in the garden. If you have grass somewhere, you can roam there. In your like maybe in outside somewhere, some porch you have, there you can walk. Or otherwise inside the home also, you can walk bare feet for maybe half an hour. You will suddenly feel some difference of energies in the body because of those points which are in the feet. They get stimulated, and with that stimulation the energy level will be increased. Second thing, try to lie down on the floor for at least like 10 to 15 minutes. You know, all the animals, if they have any condition in the body, they only do two things. One, they leave the food. A dog in the house, if we have a pet dog and he is not feeling good, you give any food, they will just smell and they will leave the food. They will not eat the food until they will not get well. So they know, if they stop the food, if they come into onto the fasting, they will get healed fast. And the second thing they do is, every morning they roll themselves on the floor. You see the donkeys, the dogs, the cows, cats, elephants, everybody, they do this. They connect themselves with the nature. Even a plant, if you root it out from the ground and you give as good water on its leaves, or you give good compost to its roots, but you don't put it into the ground, it will not grow. And we people, we disconnect ourselves from the ground all the time by sleepers on the bed, in this, that, sofas, chairs. So just try to include these things. Whatever suggestion I am giving you, if you will implant those suggestions in your daily life, then only you will be able to judge it. Yes, it is working or not. Like, never believe if somebody is saying something, do not believe it.
Yeah.
Try to be scientist, try to be follower of science, that understand it, like do your own experiment. Try to lie down on the floor yourself for 15 minutes, like for 1 week, and then see any difference, if you find the difference or not. If you don't find any difference, you do not find any benefit, just leave it. You see people on the beaches, what they are doing. With the minimum clothes on their body, they lie down in sunlight on the ground.
Yeah.
After that, how much energetic they feel. Because two systems, one is the sunlight and the other is the energy of the floor, energy of the mud or the sand. So both are giving energies. Here in India, if like any bacteria is there in our food, in our grain, then what we do, our mothers and the women of the family, they put that grain into sunlight to kill the bacteria. The same thing you guys are doing on the beaches. You yourself giving to the nature, lying down on the beach in the minimum clothes, so that maximum sunlight falls on your body. And then with the maximum sunlight, the bacteria in the body, which are not good for you, they get killed. They remove, and your cells, they get more energy with the sun. Many special hormones developed in the body with the sunlight. You know, just like few minutes of sunlight can treat the depression 100%. But instead of treating the people with sunlight, because with sunlight, if you treat somebody, it will cost nothing to them. And it will not, if it will not cost anything to them, you will not get your share. The doctors will not get this. Doctors will only get when the people, they come as a patient, they buy expensive medicines, they take expensive treatment, they get hospitalized. Only then they get money, they get their salaries. So treatment for everything is freely also available and paid also available. It is your option where to go. Either you want to go natural or you want to go the other way. You have to choose wisely. Sometimes it is really necessary to take those treatments, then go for that. If it is a case of surgery, if I explained you, if it is a case of some fracture, then you have to choose that. But maximum time, 95% of the diseases, they are related to the circulation only, you know. 95%. Only less than 5% problems in the bodies, they are organ related problems. Organ related problems means, like sometimes some particular organ is damaged, some particular organ's working efficiency is reduced, some particular organs are missing. You know, sometimes in some people, like by birth, they are not like, even you take a case of eye, sometimes retina is missing, sometimes cornea is missing, some particular part in your eye lens is not there. Then the people, they get blind, or they have different issues with the eyes. So that cannot be developed with acupressure or with magnetotherapy. You cannot develop a retina, or you cannot get a new kidney or liver till today. Maybe in future, what can happen, we don't know. The science is progressing very fast.
If when you say about the blood is one of the main issues for disease, when treating that, are there certain herbs that then would also help with your blood, cleaning it, circulation, that you could give people with the acupressure?
Yes, yes. Whenever you will treat people's points, the circulation will improve, and any kind of a condition, I told you, from tip to toe, even the hair fall, people can be treated with acupressure. You ensure the good supply, it will cover up.
No, but I mean, is there an herb that you could give with it to help the acupressure? Any
Yes.
type of herbal medicine, maybe in Ayurvedic herbs or anything that would help also the blood cleansing?
It will, because they are also natural forms. Like all the herbal medicines, from where you get from the plants. They are not developed in laboratories. The medicine, traditional medicines which allopathy is using, what they are doing is they are developing the medicine into the laboratory. And human body itself is a huge laboratory. You know, thousands of chemical reactions are happening every day in the body. Just a simple liver is like processing more than 5,000 different scientific experiments every day. It is such a huge laboratory. And we cannot compete with this laboratory. Whatever your body is needing, whatever your body is required, every day it is developing within the body. Every medicine, you see in a fraction of second, like sometimes you see when we are about to get hurt with something, and we came to know, okay, I'm going to hurt with this, and immediately many hormones comes into the body. Your heartbeat gets like higher, and you have certain stimulation around your stomach. So those things are what the body sprays the chemicals very soon, like in fraction of seconds, milliseconds, the body sprays those chemicals, and either it will you will become unconscious. Many people, before getting hurt, they become unconscious. So how fast the anesthesia is? Anesthetic who will use outside anesthesia, they have to do lot of measurements before giving that anesthesia. A slight more dose and the patient can go forever. You know how smart the mind is, that it developed the same anesthesia in the body, and before you get hurt, like sometimes this happen in accident cases, when somebody realize that they are about to get crashed, they get unconscious. So the body is that much smart that they know that this pain will not be, the person will not be able to bear that pain, so they give them this immediate unconsciousness to the person. So this much fast it is. So what we are saying is, why not we try to develop the same medicine within the body? Even after that, if you require, then the best option is go with the herbal nutrition, go with the Ayurveda, because they are not something which is developed in the laboratories. They are the homemade remedies. With the food, first of all, with food. Recently, like one of our student in Mauritius, that lady, she's also a yoga teacher in Mauritius, and around like in her 55 to 60 year maybe, and she detected with cancer. It is like 4 or 5 months ago. She detected with cancer, and the doctors, like, they said, okay, it is a third stage cancer, and you have like nearly 1 year. Okay.
Oh, wow.
Okay. So after that, she started certain juice therapy. She started to have juices of different vegetables, and white ash guard. The ash guards, they are in two different forms. Ash guard, the very big fruit or vegetable.
Okay.
So that white ash guard, she got white ash guard fruits, and she also grows some in her own garden, and started taking that juice. And you will not believe, all the reports after like 6 months are normal. Doctors are not believing it. they are not able to like digest that fact like she got cured with it. They were saying like she do not have more than 1 year, and now she will show them like how many years she lived.
Amazing. Yeah.
So natural ways are there. We have to have faith in that, and then if we practice many times, like with acupressure, I have cured many people with like severe back pain, severe sciatica pain, different things. You can easily cure it. It is you have to faith on that, and then you have to be like punctual with the points how you treat it. So you are able to see this chart.
Yes. Yes.
So the book which you will get different meridians in that, the points of the meridian, and I will also share you like sometimes some sujok therapy points. So that are also like in very brief. If I explain you, if you see this picture of my hand like this, my
Yes.
left hand. So what comes into your mind? If you carefully see it now, it looks little bit similar to a human figure. Try to observe it. Like this
Yeah.
is head, this is your head, then your neck and shoulders. Shoulders are broad like this here. You see broad here.
Yeah.
Then these two are your arms. See, and
Yes.
these two your legs. You see
Yeah.
carefully. Have you imagined your hand before today like this as a human body?
No.
No. Now see, if you see your legs and you
Yeah.
check your knee, the shape and the outer skin, the top cap of your knee is exactly similar to like this. Your
Yeah.
right knee and left knee. You have some like you see the skin is like having some kind of figures here. The same figure you will have on your knee. And if you check exactly the back side of your knee, you will have similar lines like this here. You
Yeah.
see? The same
Yes.
lines you will have in the back side of your knee. In the bottom of your leg, your feet, you see the similar ways you will have like this. If you will be able to fold your leg. So now exactly the shape of the feet you will have here. With my practice, I am able to move the first four of my fingers like this. So if you check now, this is your head, these are shoulders, these are arms, these are legs. Now your elbow, you check the elbow and see the rashes on the bottom of your elbow. The same rashes you will find here on the tip of your fingers, both sides. So they are the elbow points exactly. Now on the elbow, there is one fold here. That is the upper arm. So this is your upper arm, right and left. And after that, you have two folds. One is here, and the second fold is this one. One this, and this is second. And exactly you will see, after this, you have these two folds, 1 and 2. So this bottom area, this area you will find here. This particular area is like this, and this arm is upper one, and this is your elbow. Okay, now the whole body is in your palm. If simply somebody comes to you with a complaint of leg pain, if they are saying like, okay, I have leg pain, Melissa, or I have pain in knee, I am ready to give you a return guarantee. You treat these two fingers with like maybe some lubricant, some small quantity of oil you put here on full finger, these two fingers, and then give good deep massage like this. Press these points. If they have more knee problem, put some kind of seed. If you have a seed like any grain seed, rice or some pulses or some cereal, any seed you have, just put to help giving good pressure on the point. Because just with bare finger, if you will press, maybe you will not be able to press that much in good pressure.
Yeah.
But if you put a seed here or very small pebble also, then you can put it and then try to rotate it. So rotate it 2 times a day for 7 days. 60 to 70% of the knee pain will be healed. You note my points. You can write it down or you can have this guarantee on record. Within 6 to 7 days, 60 to 70%, because many factors are dependent on that. The age of the patient, like the last time we discussed, maybe patient is 80 years old, then at least they can have 30-40% relief. If a patient is 35-year-old, he can have 80% relief, 90% relief. 20-year boy can have 100% relief in 7 days. You know, age and the disease factor, ratio. So that should be maintained. You should know about the ratio. So you just give deep massage on this. Like sometimes you have pain in the lower legs. Many people, they have calf pain, you know, calf muscles. So in the calf muscles, they are known as second heart of the body. The calf muscles are known as second heart of, because what heart does in your body? Heart pumps the blood. The same way, the calf muscles, they also pump the blood. The calf muscles, what they do? They pump the blood upside towards the head. But like the lifestyle we have is more of the standing work if somebody is doing, like the teachers. They are all the day, either they are standing in front of the boards, they are giving tuitions, or maybe they are sitting on the chairs, or the people who use more computers, or the office going people, they all do their work by sitting on the chair. So while they are sitting on the chair, what happens? Their one leg remains downside always, and then there is a knee, so that is bent. So their muscles, the calf muscles, they are pumping the blood, but it is taking more effort for them to pump the blood in a good way towards the head. So after certain age, they become like weak, or the blood getting clotted in the bottom of the body, like in the calves. So there you will see like green color of veins. They are also known as varicose veins. You will see patients saying like we have varicose veins. Even in the inner thighs, they have green color of veins, or blackish veins, or dark red color of veins. So what it shows is, it is that blood is getting clotted there. Blood is getting like deposited there. It's kind of crystallization. So even that can be healed just with this treatment, like under this knee point. This is your lower leg. Just give good pressure here, like this, or give a good massage. We do have a tool, kind of ring, small ring. So you can also massage with the ring like this. So that will accelerate the circulation, increase the circulation, and directly it is connected to your knee. Nature has given these switchboards, and they have also given you certain hints. If you look it carefully, you will exactly know, okay, now you can treat the whole body. Just with this one session, you can treat the whole body. If somebody is having headache, migraine, where do you will give pain? Where do you will give treatment? Let me know.
Here.
Yeah, smart enough. You know, this is your head. So even if you have a headache, you have migraine, you have a memory, see, we are not treating the symptom. We are treating the organ points. Try to understand this point. This is very important. There can be 1,000 disease related to just one small part of the body. Like the brain, you take, for example, brain. There are 1,000 is very less number. More than 10,000 diseases are there related to the brain, or neurological disorders. 100 different types of doctors are there to treat just the brain. You know, so we cannot fight with those symptoms. Sometimes people come with a problem where when they say the name, we don't know even what the disease is. We have to check it online. But if once we know this disease is related to your brain, your head, then we know, okay, this is the head area. Even in reflexology chart, if you see, this is the head area. So what you can do is you can simply treat the head area points. How? You can give a good pressure with some seed. You can give a pressure with your hands. Yeah.
Do you always treat the left hand of the patient?
In reflexology or acupressure, the points are in both hands. If you see in the chart, the head points are here, right also, left also. Only the organs which are not in pair in your body, like you do not have one pair, they will be in one side. Or if you dissection the body vertically, if you dissection the body, you know dissection, if you divide the body in two parts, whatever parts remain in which side, the points of those reflex will be in that particular hand or feet. Let me explain you again. Maybe there are, if you dissection like this from here, so this nose, you see, will be in the both sides, right and left. So nose points you will have in both your hands, both your feet. Eyes, both sides you will have. The brain will divide into right brain, left hemisphere, and right hemisphere. So you will get points of the brain in both sides. But the heart where will be? If you dissection it, the heart will remain into
Left side.
So the points for the heart you will find in only left hand side or in the left of your feet. The same way, the points for the spleen you will find in only one side of the body. Got it? So it is explained in the chart. What I request you to all the students, we say, draw this chart with your own hands. Just to take out the print will not work that much, because the print you get it computerized with the printer. You have not worked on that. But once you will make the chart with your own hands and you will mark those points, you'll be able to remember those points. Okay, these are the points, this is the point, this is the point. Exactly. So with that, once you will remember the point, immediately you will know, okay, somebody has come with something related to head. This is the working field for me. Now I have to work here only. So you have to use the magnetotherapy on the direct area. Then you have to use the Sujok or acupressure therapy on this particular area. If you want to do the acupuncture, you know the needles, then you can use the needles on this particular point. So that simple it is. That much simple it is. Right? After that, if you know somebody is having some cervical issue, neck issue like this area or this thyroid area, then what you will do is, then you will go a little more down here. Then here you will press points for the neck. Yes. Anybody having suffering from any kind of neck pain, just give pressure points here, give a good massage here, you will feel better. Sometimes, somebody is complaining for neck pain, don't touch their neck. Do not do anything, no massage on the neck. Just do massage here. Then check, like within 5 minutes, 10 minutes, do they feel some difference or not? The same way, sinusitis. Sinusitis, where the nausea comes and running nose and you have cough and cold. So simply use the points on the tips of your fingers. This you will be able to see in the chart also. So just tip of the fingers, you press them very well in the morning, like 3 to 5 minutes, 2 or 3 times, or afternoon or evening. In a day or two, you will find like the nausea is gone. Even the medicines take like 4 or 5 days of course. 3 to 4 days you have to take antibiotics and then other medicines. But it will heal faster than that. So there are many points in many next classes. We will definitely discuss those also. But just for today, as a homework, you can just do these things. Like whoever you meet, try to volunteer yourself. Okay, let me check some points on your hands. I am learning this new technique. Let me do some experiments, and you will not be harmed because there is no side effect. But you will definitely get good relax. So treat their legs points, treat their hands points, then treat their this head area, neck area, shoulder area, and the whole of the spine. This area, outer layer of the thumb. If you see in the chart, in the middle there is a spine sketch is there. So this whole area from the top to bottom of your thumb, see this particular area. This is your entire spine. All the 33 vertebrae are there. So if you with a roller you give good massage here or you give good pressure points here, the whole spine can be treated. Somebody is having pain in the lower back, where you will press the points, lower back, you will definitely know, okay, it will come near about this side. Don't worry about the exact point. As many times you will try with as many different hands, different feet, you will reach closer to locate the point. Get my point? It is about practice. All about practice. As many times you will practice, maybe first time you will not be able to guide it, able to find it well. No matter. At least you try. Second time you will reach much better approach to the point. In fourth, fifth time you will immediately catch the point. And then what you do? Try to press very step by step, close. And somewhere the patient will show some pain symptom on the face. So don't forget to see the outcome. See the outcome on the face. What result it is showing. And when I say, oh, painful condition, then exactly you can say, okay. So from 1 to 33 vertebra, if you will count, you will be able to know, okay, it is T12, thoracic vertebra, 12th point. You will write it T12. If they go to MRI, they do X-ray or MRI, they will come with the same result. Nearly like 200 or 300 US dollars they pay here in India for MRI. I don't know what would be there. But
1,000.
1,000, see. So $1,000 work you can do in 30 seconds.
Yeah.
That much of advancement it is.
Does it matter how much time you spend doing the pressure on the patient? Is there a certain time you have to do it, or?
It is generally 30 seconds in one go, up to 3 minutes. Starting from 30 seconds to 3 minutes means this one particular point I have to press for 3 minutes, but at a time not more than 30 seconds. Because if you keep on pressing the point and patient is full of pain, is screaming, then it makes no sense to press for 3 minutes. So like I started with 10 seconds. In first demo, what I said, okay, count for 10. So then you can count for 15. Then you can count for 20. Gradually increase it. Do not
But
try
no more
to attempt.
no more than 3
First
minutes.
attempt, do not try to have the full result in one day. You see, gradually you increase the time. And up to 3 minutes. In Chinese acupressure, Chinese acupuncture, they treat particular point for 3 minutes. You have back pain, they treat for 3 minutes. But what I suggest is start with less time. Maybe you can start with 10 seconds, rotate it 10 seconds, then give a pause for 30 seconds. Again 10 seconds, give a pause to recover the cell, recover the circulation. Then like this, you do 3 minutes, then you can try for the other point. All right. So it is that simple. So this chart, which I have displayed on the screen, is very important point. As we were discussing, like the Indian women, they wear different kind of ornaments. Out of those ornaments, this one ornament called bindi, we call it bindi, dot. So that dot is very important. Every married Indian woman, you will see they have this Indian bindi. Yeah, exactly the middle point of your eyebrow. In
Here
yoga,
or low?
yeah, in yoga, it is called third eye point. Third eye point. And
is it above the eyebrows or between them?
Yeah, it is just middle between.
Between here? So
Yeah. See in the picture. That is there.
Yeah.
So this point is called Jnana Kendra, knowledge point. This is knowledge point. It is also intuition points. This point shows improves your intuitive powers. You develop certain intuitions in your mind. You can judge, like you can judge people, you can see and observe like what kind of intentions they have, or you are able to think over your decisions. If this decision I am taking is wrong, right, you will have more, inner calling with this. You'll be able to get your answers. Like sometimes you are sleeping with the problem, but when you wake up with the solution. Just like that. So that kind of powers this point can give. It is called GV 24.5. So GV 24 points, what it can cure. How to treat is simple. What I said is 30 seconds. So what you can do is you can use your thumb like this. You can use your thumb like this. This thumb, right or left, anything, whatever is convenient. So like I'm putting my right hand here. Then all the fingers you can put on the top of the head to support. Then the other hand you can put it in the back side of your head. Now just putting it and rotate it slowly. 1,
clockwise?
2. Yes, I'm doing clockwise. 3, 4, 5, 6, 7, 8, 9, 10. And then slightly give pressure and release. So this is one circle of the treatment. So by pressing this point, in acupuncture, you can also insert the needles. In magnetotherapy, what you will do? You will put a certain pole of the magnet on this point. That we will discuss in magnetotherapy session. Which pole, how much should be the power, how much should be the time. All those things are parameters. They will be explained to you. So just for the knowledge, you can put up this magnet also. There was a queen Cleopatra in Athens. She used to wear a magnet here all the time. If you see her picture, that is like she knew this fact from somewhere that it will enhance the beauty and the courage and the mind powers. So she used to wear this all the time. There are many in all the Indian women. They have an ornament that is in India we call it bor rakdi. So
beautiful.
the Indian women, they have a kind of jewelry which has a big gold point, and that gold point touches here. Then they have a chain here, they tie it here, and then the two rings, they go to the ears. So in one way, in one ornament, they cover all three important points: this center, and this head area. How smart the youngsters were.
Very smart.
They informed these ornaments as a beauty thing, and it is also treating the people who are using it. So one fingers beneath about the point between the eyebrows, it is located almost in the middle of the forehead.
Okay.
There are certain points in the body, like as I explained you in the first session, like throughout the body we have the points. In both your palm we have the points, in both your feet we have the points. But these points are divided into three different qualities, you can say, or three different factors. What are these three factors? Few points are called sensitive points, very sensitive, or you can say extremely sensitive points. Then few points, they are the mild points, like they are middle points, they are semi-sensitive or semi-strong. And then the third categories, they are the strong points or the tough body points, you can say. So as you can realize, this particular point is a sensitive point. What are the sensitive points? Like whatever the body parts, wherever if you give any pressure or you press those points, they are so sensitive that you cannot bear the pain up to an extent, up to a limit. So after that, you will not be able to bear that pain, or you cannot press that much on those areas. Those are the sensitive areas. I think you can easily understand which are the sensitive areas in the body. Just for example, like your eyes, they are very sensitive. This particular point is very sensitive points. The temple points on your head, like these are two temple points. If you try to push these temple points like this, you see, you will not be able to push very much. So these are the sensitive points, temple points. Then down the earlobes, 2 points, they are also very sensitive points. If you press, in Marma therapy in old schools, there was a Marma therapy. So there was a technique, like there was a art, like a martial art, you see. So this Marma therapy was as advanced. The fighter just presses a certain nerve on the opponent's body, and they can defeat the opponent.
Yeah.
They become unconscious. So there are points like this point can create unconsciousness in the body if you press it too hard. So this is also a sensitive point. Then your belly button is also sensitive point. The anus points and the genetical points are also sensitive points. So these are certain around the nose, on the top of the nose, tip of the nose, on the top of the lips, upper lip. These are all sensitive, right? Semi-sensitive points are, or semi-strong points are, like your wrist, your fingers points. These are all semi-sensitive. They can bear certain pressure, but they cannot bear that much pressure that you break a finger. If you push too much, and the bones are so thin that they can even break if you not use the devices wisely. So you have to be careful with the sensitive or semi-sensitive. Then there are some strong parts. Strong body parts are like the thigh muscles, the hamstrings are the most powerful bones in the body. Then you have knee joints. You have the spine. The whole of the spine is the strong area, but in the sides of the spine and the vertebrae, they need to be carefully. You need to be very careful when you treat any particular problem in the spine, because you should never touch the bones of the spine. We are not treating the bones. In acupressure, there is no pressure point on the bones. Always remember, there is no pressure point in the body which is located on the bones. There is no point. Okay? So we cannot touch the bones, or we cannot manipulate with the bone. That practice is something different. Chiropractic is different. So chiropractic people, like even I do the adjustments, the back adjustments. Sometimes people come with the back pain or neck pain, cervical pain. Then we do the chiropractic with them. We adjust their bones, but those things are different. They need more of the expertise. Everybody cannot do that. They can even give more harm. The
Yeah.
bones can be like fracture, or they can be dislocation. There can be many problems. So you have to be careful with that. There is no point on the bone. Okay, never treat a bone. So stronger areas are the knee joints are, the calves are, thighs are, the shoulders are, the spine is, and cervical is semi. The top points, like from 1 to 7 vertebrae of your spine, the top 7 vertebrae of your spine, they are not strong points. They are semi. They are not very soft, but semi means what is sensitive, what is semi, or what is strong is sensitive. You have to use very gentle pressure, like feather touch. In massage therapy, we say feather massage. So, like feather touch, you have to give the treatment, then see the result in the eyes or the face. If the patient is comfortable, little bit increase the pressure. Still, if they are comfortable, then you can little bit, you can increase gradually as per their comfort. And the timing also you can increase gradually, day by day. So like this you can do. Then on the semi-sensitive, where the area, the parts are not very strong or not very soft, there you can put little more pressure than the sensitive, right? And then the strongest part, there you can have like good pressure, like the sole of the feet. Sometimes we are giving pressure with the hands, and the people have their feet so rough that you cannot even press with the hands. You know, especially the people who work more like labor work, labor class people, and they have like more physical work. So their hands and feet, they are so rough. If you press with your hands, like your hands will be so soft that you cannot even generate a good pressure. In that case, you can either use some devices, or otherwise you can just hold the finger like this, and then this tip you can use. Like check it like this, you make like this, and then try to treat any point. You will have very good pressure, like in different areas. You see?
Yes.
So these are different solutions. So with this particular point, I want you to practice this point for today with you or with any of your family member or neighbor. You can ask them, okay, I'm learning something new, and I have some points for you. You can also show them this picture, that this will help you in headaches, in sinus pain, in insomnia, in ulcer pain, fatigue, anxiety, or it also calm the mind. If somebody says, sometimes, you know, if you volunteer yourself that, okay, I want to treat you this point, they say, oh, we are not diseased, we are not ill, I don't have any of these problems. So then what you have to do is, this particular science, reflexology or acupressure or magnetotherapy, they are a specific science which is, you know, more of a preventive science. These sciences are known as preventive science. You know, it is called like prevention is always better than cure. Prevention is always better than cure.
Cure.
So what you can explain is, if like somehow, you know, like in India, the astrologers are very famous. We people, like many people, they want to do anything, they go to astrologer and they ask to astrologers about their future. Okay. I never go to the astrologers. I create my future. I don't believe in asking to others. What you want to create for you, you can create it right now. So, just for example, if some astrologer will tell you, okay, after 15 days you will have headache, or after 15 days you will have this fatigue or anxiety, then you cannot take a pill for that. My question is, if anyhow you come to know that after 2 days you will have headache, then you cannot take a pill before you have a headache. After the headache only you can take the pill. But in this science, you can start curing it before it appears. Because in body, what happens? The symptoms comes very late. First, they are growing in the body. After a certain period of time, when the symptoms are like they are completely high in the livers in the body, then they arise. Then we start to see those symptoms outside, like in form of cancer. Sometimes when it goes to second stage, it goes to third or fourth stage, then only we realize. Then only patient can know, okay, now they have got suffered with cancer. Initially, they don't know. So in this science, you can prevent the problem which will come into the future. For example, if like somebody is having a history of thyroid problem, or somebody is having a history of like diabetes problem, you know, sugar problem, even the stress or anxiety is also like genetically can be transferred in your genes. So if you have any genetic history from your parents or from your grandparents, then it is better you start treating those points of thyroid, those points of diabetes mellitus, or sugar problem, blood pressure, or heart issues. If from the childhood you give like in a week only you give for 5 minutes of these points stimulation, then those kids when they will be developed in the full adults, they will not get caught with these diseases because you prevented them with these therapies. So if somebody says I have not got anything or any problem from this, don't worry. With this treatment, you will get more relaxed. You will have more sharp memory. You will have more calm mind with these points. You will not get any kind of side effect. You see, with this point, only what can happen in the worst case, what can happen? Somebody can have a so sensitive skin, and maybe you have pressed too hard, it can become little black. The skin can have a dark black dot that will remain for like 1 week, 10 days, and they will remember you for those 10 days. So you have to be careful that press it little light, ask them if they are comfortable, then again. So in India, what we do, when we go to the temple, we go to any spiritual places, Gurudwara, they put bindis. The pujaris, they have some sandal with them, sandal powder, chandan. So they apply a bindi with the sandal. So the sandal does one thing, it keep you calm, it keep you cold, keep your mind very calm, and then they also presses this. In Indian houses, when you go, they will welcome you with a bindi like this. It is what they are activating your chakra. How beautiful the science was.
Yeah.
This GV20, it is a universal point. Any disease which exists in the world, for all those like in acupuncture science, whenever you study, any problem points protocol you are making, you have to treat this GV20. Governing vessel, it is called governing vessel. GV20 is governing vessel point number 20, right? So this you have to treat. Where you will find, you see there is a round circle of your hair where exactly in the center, top of your head. And if you slightly try to push it, you will feel a round point kind of like green peas, green pea. So kind of green pea seed you will see here. And with this finger, the finger which is close to your palm, try to press it like this in a small circle. So this point, a certain sensation you will feel. If you are exactly feeling that certain sensation, that means you have approached to the correct point. That is known as GV20. So this is a master point, center of the top of the head, where the line connecting the high points of your ears crosses the body midline until you feel a slight dip. You able to feel it exactly here? So it is again a sensitive point. Apply very sensitive pressure on that. You can stimulate it, rotate it 10 to 15 seconds, then you can leave. There is a therapy where they put a piece of ice cube on this point. A piece of ice cube, if you put it here, you will feel very relaxed. Also in the MO point, medulla oblongata, here, in the back of your neck, here, you will see a kind of pit there, a kind of hole. So you can fix your thumb here. So that point is also known as MO, medulla oblongata point, starting point of your spinal bone. There also they put a ice cube. It's a treatment. So if you put ice cube there, you'll feel whatever I am telling you, don't believe it. Experience it.
Try it.
If you experience yourself, then you will be able to know, okay, what sir was saying was right or not. Because I have done my own experiences, then I am telling you. But if you do it yourself, then after practical, the different kind of confidence will be there in your eyes. When you will try to explain it to your people, you will be able to describe it with more confidence once you do it yourself, right? So this point is beneficial in insomnia. Insomnia is like sleeplessness. If you don't have good sleep, just try to press these points in the night. Then for the epilepsy patient, this point is very good. There are certain points more for epilepsy. This point is also good for the epilepsy. Upper lip, just under the nose. In Indian tradition, you'll be laughing like whenever somebody got epilepsy attacks on the road, people they remove their shoes and the tip of the shoes they used to touch here.
Wow.
They think like with the smell of the shoes, person will get all right. Like the people used to think that with the smell of the shoes, the epilepsy attack will go, but it is not the smell of the shoes which is
The
working,
pressure.
or the tip of the shoes which is pressing here, because that point related to the epilepsy problem, and immediately the attack is normal. The patient feel much better. So scientifically, like the solution was there, but the thinking, what they were thinking is wrong. Like they were thinking it is because of the smell of the shoes, but it is because of the tip of the shoes which presses the point, and you get cured with the epilepsy. Right? The same dizziness and hot flashes, blurred vision. For the vision also, this point is important. Any kind of nasal obstacles, for that also obstructions, that is also can be cured with this. Then it is good point to improve memory and concentration in the children or in old age patients. Also good for the Alzheimer's patients. I often read some articles like in Europe there are more Alzheimer patients. In USA also there are more patients having these Alzheimer problems. Maybe it's a kind of lifestyle problem. So those all things can be treated with this point, GV20. These points you have to draw with your own picture. The same picture you can draw in your own hands, then you can mark those points there, and then you can treat it. This is again gallbladder meridian 20, GV20 point is exactly use your both thumb and put one side and the other side in the back side. Let me show you like this. Like this and like this. So this point you do. Wonderful point to treat cervical problems like this. You will be able to know, like slightly press it, slightly touch it. If a different kind of sensation, a very light kind of pain you will feel, you will know that okay, this is the exact point. Just below the bone. And nature has made your hands in a certain proportion. You know, all of the body, nature has given us in a perfect proportion. With our eating habits, with our lifestyle, we disturb the proportion. The proportion which nature gave was absolutely well. When a newborn baby is born, everything is in a right proportion. After we live day by day, year by year, we disturb the proportion. You know, so the hands and this point, the proportion for every individual is the way that exactly it will cover those points. So like this, you can treat it like. So below the base of the skull, this point in the hollow between the two large vertical neck muscles, 2 or 3 inches apart, depending on the size of the head. It says that depending on the size, because every individual has a different skull. Every individual has a different parameters, different dimensions. So accordingly, you have to adjust. Nobody can tell you, okay, exactly on this point it will come. No. You have to check. You have to read the face of the person. If you are pressing the right point, you will see the right symptom on the face. Then this is also very sensitive point. Once you will press your own point, then you will know, okay, this is a sensitive point. This cannot be pressed too hard. You try to push little hard. Even after 2-3 days, you will have some pain here with the pressure. So very gently you have to treat this point. Good for fever, good for occipital headache, or in shoulder pain, because this point also covers the cervical area. C1 to C7, all the cervical veins.